Every year, millions of older adults are affected by a condition that strikes without warning and leaves devastating consequences if not caught early. We're talking about stroke, a leading cause of long-term disability and one of the top killers worldwide. But here's the good news. If you can recognize the early signs of stroke, you can act fast and potentially save a life. Part 1. What is a stroke? A stroke is a serious medical condition that happens when the blood flow to part of the brain is interrupted or reduced, preventing brain tissue from getting the oxygen and nutrients it needs. Within minutes, brain cells begin to die. This sudden disruption can lead to permanent brain damage, disability, or even death if not treated quickly. There are two main types of strokes. The most common one is called an ischemic stroke, which occurs when a blood clot blocks a vessel in the brain. This accounts for nearly 87% of all stroke cases. The other type is a hemorrhagic stroke, which happens when a blood vessel in the brain bursts, causing bleeding into or around the brain. A third, less severe type is called a transient ischemic attack, or TIA, often referred to as a mini-stroke, where symptoms last for a short time and resolve on their own. But it's still a serious warning sign. The brain controls everything we do, from moving, speaking, breathing, to thinking. So when a stroke damages a part of the brain, the effects depend on which area was affected and how severe the damage is. Someone who suffers a stroke might suddenly have trouble speaking or understanding others, might feel weakness or numbness on one side of the body, or might experience a sudden, severe headache, dizziness, or even lose consciousness. These symptoms can come on suddenly, and recognizing them quickly is crucial. That's why doctors use the acronym FAST to help remember the signs: face drooping, arm weakness, speech difficulty, and time to call emergency services. The sooner a stroke is treated, the better the chances of recovery. Strokes are one of the leading causes of death and long-term disability worldwide, especially among older adults. However, up to 80% of strokes are preventable through lifestyle changes like controlling high blood pressure, managing diabetes, avoiding smoking, exercising regularly, and eating a heart-healthy diet. Understanding what a stroke is and how to recognize its warning signs can save lives, perhaps even your own or that of someone you love. Part 2. Why seniors are more at risk. As we age, our bodies naturally undergo many changes in the heart, blood vessels, brain, muscles, and immune system. These changes often make seniors more vulnerable to health problems, including life-threatening conditions like stroke, heart disease, infections, and falls. One of the most significant reasons older adults are more at risk is the gradual weakening of the body's natural defense systems. For example, the immune system becomes less efficient, making it harder to fight off infections or recover from illnesses that would be minor for a younger person. A simple cold can turn into pneumonia, and a small wound can become a serious infection. Another major factor is the presence of chronic conditions. Most seniors live with at least one chronic illness, such as diabetes, high blood pressure, or arthritis. These conditions often interact with one another and increase the risk of complications. For instance, high blood pressure can damage blood vessels over time, increasing the chances of a stroke or heart attack. Diabetes can affect blood circulation and nerve function, making wounds heal slowly and increasing the risk of infections and amputations. When multiple conditions exist together, the risks don't just add up, they multiply. Seniors are also more prone to falls and accidents due to a combination of factors: reduced muscle strength, poor balance, slower reflexes, and sometimes impaired vision or hearing. A fall that might be minor for a younger person can be devastating for a senior, leading to hip fractures, head injuries, or long hospital stays. On top of that, many older adults take several medications and polypharmacy. Taking multiple drugs at the same time can cause dangerous interactions, dizziness, confusion, or increased fall risk. And let's not forget the impact of loneliness and isolation, which are surprisingly common among seniors. Social isolation can contribute to depression, anxiety, and even physical decline. Studies show that loneliness can have an effect on health as serious as smoking or obesity. Without a support system, seniors may delay seeking care, skip medications, or fail to notice serious symptoms. All of these factors combined make seniors more vulnerable, not because they're weak, but because aging is complex. But the good news is that many of these risks can be reduced through preventive care, healthy living, regular checkups, and strong social support. Understanding these risks is the first step toward protecting our health and the health of those we love as we grow older. Part 3. The subtle early warning signs you should never ignore. Sometimes, our bodies whisper before they scream. The earliest signs of a serious health problem are often subtle, so subtle that many people brush them off as nothing. But for older adults, these quiet warnings can be the difference between catching a problem early or facing a life-threatening condition later on. One common early sign that often goes unnoticed is unexplained fatigue. If you're suddenly more tired than usual, even after a good night's sleep, it could be more than just aging. Fatigue can signal heart disease, anemia, thyroid issues, or even certain cancers. It's your body's way of saying something's not right. Another early warning sign is sudden weight loss without trying. Many seniors think, "Oh, that's a good thing." But losing weight without a change in diet or exercise can actually be a red flag. It could indicate digestive problems, diabetes, depression, or even cancer. Similarly, loss of appetite that lasts more than a few days should never be ignored. The body needs fuel to function. If you're not hungry, your body might be in distress. Mild confusion or memory problems are also worth paying attention to. While forgetfulness can be a normal part of aging, sudden or increasing confusion, difficulty finding words, or getting lost in familiar places could be early signs of dementia, stroke, or even a urinary tract infection, which can cause cognitive symptoms in older adults. The earlier you catch these changes, the more treatment options are available. Pay attention to subtle changes in bowel or bladder habits. Blood in the stool, constipation, or frequent urination can be early indicators of colon cancer, prostate problems, or urinary tract infections. And if you ever feel short of breath doing simple tasks, like walking to the mailbox or climbing a few stairs, it could be an early sign of heart or lung disease. Many people ignore this, thinking it's just getting old, but that shortness of breath could be your heart struggling to keep up. Even mood changes can be early warning signs. Feeling unusually sad, irritable, or anxious without a clear reason might point to depression, vitamin deficiencies, or even neurological changes. These mental health symptoms are just as important as physical ones, and they deserve attention, not dismissal. The truth is, the body often gives us clues before a major health event happens. The key is listening. If something feels off, even if it seems small, don't ignore it. Talk to a doctor. It's always better to check and find out it's nothing than to wait and discover it's something serious. When it comes to health, early action saves lives. Part 4. Use the FAST test. When it comes to stroke, every second counts. A stroke happens when blood flow to the brain is suddenly cut off, either by a clot blocking an artery or by a blood vessel bursting. Without oxygen-rich blood, brain cells begin to die within minutes. That's why recognizing the signs of a stroke quickly and calling for emergency help immediately can mean the difference between full recovery and lifelong disability, or even death. One of the most powerful tools we have to spot a stroke early is the simple and easy to remember FAST test. So, what does FAST stand for? F is for face. Ask the person to smile. Look closely. Is one side of the face drooping or uneven? A lopsided smile is a classic sign of a stroke. A is for arms. Ask the person to raise both arms. Does one arm drift downward? Are they unable to lift one side? Weakness or numbness on one side of the body is a key warning sign. S is for speech. Ask them to repeat a simple sentence, like the sky is blue. Is their speech slurred, strange, or hard to understand? Stroke often affects the brain's language center. T is for time, and this might be the most important part. If you see any of these signs, call emergency services immediately. Don't wait. Don't assume it will go away. Getting medical help fast can dramatically improve the outcome. The reason time is so critical is because some stroke treatments, like clot-busting medications, must be given within a few hours of the first symptom. The faster you act, the more brain you save. Studies show that patients who get treated within the golden window much more likely to recover fully or avoid serious disability. But every minute counts. That's why knowing the FAST test and using it can literally save a life. It's also important to remember that strokes don't always cause pain. That's one reason why people often ignore the early signs. But if someone looks confused, suddenly can't speak properly, has trouble walking, or loses balance, even for just a moment, it could be a stroke. Don't second guess it. Use the FAST test, trust your instincts, and get help right away. This simple acronym has already helped save countless lives. Knowing it and sharing it with your loved ones, especially if they're over 60 or have risk factors like high blood pressure, diabetes, or a history of smoking, can make all the difference. Because when it comes to stroke, acting fast isn't just smart, it's life-saving. When we talk about health, most people know the major red flags: chest pain, sudden weakness, slurred speech. But what about the signs that are less obvious? The ones that don't scream for attention, but quietly whisper that something isn't right. These less common, but still serious warning signs often go unnoticed, especially in older adults. Yet they can be the early clues to dangerous conditions like stroke, heart disease, infections, or even cancer. Paying attention to these subtle changes can make a life-saving difference. One example is sudden vision problems, blurry vision, double vision, or even brief episodes of blindness in one eye might not seem urgent, but they can be early signs of a stroke or a warning of a blocked artery in the brain or eye. Don't just assume it's aging eyesight. If it comes on suddenly, get checked immediately. Another often ignored symptom is persistent hiccups, especially when paired with chest discomfort. While hiccups seem harmless, in rare cases, they can be an early symptom of a stroke, particularly in women. Unusual sweating, especially cold sweats or sweating without exertion, can signal a heart attack, even without chest pain. This is especially common in women and older adults, where heart attacks can show up in atypical ways. Likewise, jaw pain, back pain, or pain in the left arm, if unexplained, could be heart-related, not just muscle strain. New or worsening depression, anxiety, or confusion in older adults should never be brushed off as just getting older. These could be signs of an infection, thyroid disorder, or even the early stages of dementia. Infections like urinary tract infections (UTIs), for example, can cause sudden confusion or agitation in seniors, even without the typical burning sensation or fever. Another subtle red flag is changes in handwriting or coordination. If someone suddenly starts writing messily, struggles to button a shirt, or drops things more often, it could be a sign of a neurological issue, such as Parkinson's disease or the early stages of a stroke. And let's not forget persistent indigestion or difficulty swallowing. These may seem like digestive nuisances, but they can sometimes be early signs of esophageal or stomach cancer. These lesser-known symptoms often slip under the radar because they're mild, strange, or seem unrelated to any serious illness. But if something feels off, even if it doesn't seem urgent, it's always worth getting it checked out. Don't wait for a dramatic symptom to act. Our bodies are constantly sending signals, and sometimes the quietest ones are the most important. Trust your instincts, listen to your body, and never be afraid to speak up, because early detection saves lives. Part 6. What to do in the first 60 minutes. When a medical emergency strikes, whether it's a stroke, a heart attack, or a serious injury, the first 60 minutes, often called the golden hour, are absolutely critical. What you do during this time can mean the difference between full recovery, long-term disability, or even death. That's why it's so important, especially for older adults and their caregivers, to know exactly what to do and act without hesitation. The very first step is recognizing that something is wrong. Symptoms like sudden weakness, slurred speech, chest discomfort, shortness of breath, or confusion are never normal, especially if they come on quickly. Time is brain, time is heart, and every second counts. If you suspect a stroke, use the FAST test. Check for face drooping, arm weakness, speech difficulty, and know it's time to call emergency services. Don't wait to see if it gets better. Don't try to drive yourself or a loved one to the hospital. Call emergency medical services immediately. While you're waiting for help to arrive, stay calm but focused. Write down the time symptoms first appeared. This information can help doctors decide which treatments are still possible. For example, some stroke medications are only effective if given within the first few hours. If the person is unconscious but breathing, place them on their side to prevent choking. If they've stopped breathing or have no pulse, begin CPR if you know how, and don't worry about doing it wrong, because doing something is always better than nothing. Don't give the person anything to eat or drink. They could choke. If they're having a heart attack, chewing an aspirin if they're not allergic may help thin the blood and reduce damage. But again, only if advised by emergency personnel or if it's part of a known heart attack action plan. If the person is diabetic and unconscious, and you suspect low blood sugar, emergency responders may provide glucose treatment. Don't try to force anything into their mouth if they're not fully awake. Equally important, stay by their side. Talk to them, reassure them, and try to keep them calm. Anxiety can make symptoms worse, especially during a heart event. When the ambulance arrives, give clear information. What happened when symptoms started, any medical history, allergies, or medications they're taking. The first 60 minutes aren't just about reacting, they're about acting quickly, calmly, and correctly. Preparation is key. Post emergency numbers near the phone. Keep a list of medications and medical history ready. And most importantly, never ignore your gut instinct. If something feels wrong, it probably is. Taking action in that first hour can save a life, maybe your own, or that of someone you love. Part 7. How to reduce stroke risk in older adults. Stroke is one of the leading causes of disability and death in older adults. But the good news is that up to 80% of strokes are preventable. That's a powerful statistic, and it means that by making smart, consistent lifestyle choices, seniors can take real control over their health and significantly lower their risk. So, how exactly can we reduce stroke risk as we age? First and foremost, manage high blood pressure. This is the single biggest risk factor for stroke. Over time, high blood pressure damages the walls of blood vessels, making them more likely to clog or burst. Seniors should monitor their blood pressure regularly, either at home or during doctor visits, and take prescribed medications exactly as directed. Even small improvements in blood pressure can drastically reduce stroke risk. Next, it's essential to control blood sugar levels, especially for those with diabetes or prediabetes. High blood sugar can damage blood vessels and nerves, increasing the chance of stroke and other cardiovascular diseases. A balanced diet, rich in vegetables, fruits, whole grains, and lean proteins, along with regular physical activity, can help keep blood sugar stable. For older adults, even gentle exercises like walking, stretching, or Tai Chi a few times a week can make a big difference. Another key area is cholesterol management. High levels of LDL bad cholesterol can lead to plaque buildup in the arteries, increasing stroke risk. Seniors should work with their healthcare provider to monitor cholesterol levels and make dietary adjustments if needed, such as cutting back on fried foods, red meat, and processed snacks. Quit smoking and limit alcohol. Smoking thickens blood and damages blood vessels, while heavy alcohol use can raise blood pressure. If quitting smoking feels difficult, talk to your doctor. There are many resources and support systems available. Even cutting back gradually can have major benefits. Don't forget the power of regular physical activity. It improves circulation, helps maintain a healthy weight, reduces stress, and supports heart and brain health. Aim for at least 30 minutes of moderate activity most days. And remember, it's never too late to start. Lastly, stay socially connected and mentally active. Loneliness and depression are often overlooked, but they can raise stress hormones, impact heart health, and increase stroke risk. Whether it's joining a walking group, taking up a hobby, volunteering, or simply chatting with family and friends, social engagement keeps both the mind and body healthy. Preventing stroke isn't about perfection. It's about small, daily steps that add up over time. By staying informed, proactive, and connected to healthcare support, older adults can greatly reduce their stroke risk and enjoy more years of vibrant, independent living. The power to protect your brain and your future is in your hands. Starting today, Part 8, Final Thoughts. A stroke doesn't have to steal your future or your loved ones. By learning to recognize the early signs and taking action fast, you become a protector, a hero, and maybe even a lifesaver. Thanks for watching. If this video helped you, share it with someone you love. And don't forget to subscribe for more life-saving health tips for older adults.